Good morning, everyone. We still have front row seats up here, and I've been told that they're not charging extra for the front row seats, so, make your way on in the tent. Good morning and welcome. What a great day for all of us. This is an exciting day for us. It's an exciting day for Intermountain Homecare and specifically for Intermountain Homecare and their services. My name is Larry Hancock. I'm the Region Vice President for Intermountain Homecare, and it is truly my privilege and pleasure to be with you today and to welcome you. And I've been asked to conduct this event and to lead the agenda today. So thank you for being here. I'd like to first start by recognizing some individuals that are with us. First, Laura Kaiser, who is Executive Vice President and Chief Operating Officer for Intermountain Homecare, is on the stand with us, and she will be addressing us in a few moments. Also, Joanne Bott, who is seated next to Laura. Joanne is with Manning, Curtis, Bradshaw, and Bednar, and Joanne serves as the board chair for the advisory board for Intermountain Homecare Services. We'd also like to recognize other members of the board, both from Intermountain Homecare Services and also from the Foundation for Home Care and Hospice. We'd also like to welcome and recognize Mayor Scott Osborne from the city of South Jordan, who's with us and will be addressing us also shortly. We recognize Chris Evans from the South Jordan, who is the South Jordan Fire Chief, and also other representatives from the South Jordan Fire Department. Thank you for your service, and thank you for taking time to be with us this morning. What a pleasure to be with you. We'd like to recognize Lieutenant Rob Hansen with the South Jordan Police Department, and thank you for your service. And we recognize Jan Goodrich, who is an Assistant Vice President and Administrator for Home Care Services. He's on the stand with us. He too will say a few words shortly. And Dr. Veer Lancaster, who is the Medical Director for our Home Care Services. We also recognize representatives from South Jordan City, the South Jordan City Council, and also from members from the Chamber of Commerce. Welcome to all of you. And we acknowledge our new friends here from this beautiful community, and neighbors, and business leaders, and other business associates that have joined us. Thank you for being here, and thanks for supporting this event. We very much look forward to being a part of your neighborhood, and we certainly hope that you're as enthusiastic about having us here as we are to be here. Intermountain Homecare prides itself on delivering extraordinary health care to the homes of our patients in the communities that we serve. We believe that this new facility will greatly enhance our ability to bring the care our patients have come to expect from us, with enhanced logistics, better technologies, and a location that better suits our ability to serve the growing population. You can see from the architectural drawings here that this is going to be a beautiful new building. And we very much look forward to the development of it over the next several months, and we certainly hope that it will be a welcome addition to your great community. Now, we're going to follow the agenda as shown in the printed program, and we have 4 speakers, and I've already introduced each one of them, but we'll go in this order. First, we'll hear from Laura Kaiser, Executive Vice President and Chief Operating Officer for Intermountain Homecare. Following Laura, we'll hear from Joanne Bott, Chair of the Advisory Board for Intermountain Homecare Services. Following Joanne, we will then hear from Jan Goodrich, Administrator for Home Care. And following Jan, we will then hear from Mayor Scott Osborne. And we'll go to that point in the program. Laura, I'll turn the time to you.
Thank you so much, Larry. I'm delighted to be here with all of you. And I'm going to apologize in advance. I've reached the age where I actually need my glasses to read, and all I have are my sunglasses, so I'm not trying to do anything really cool when I put them on and I'm addressing you. So anyway, but I wanted, before I shared some formal remarks, I just wanted to stop and ask all of you to join me in applauding the amazing effort that is culminated in today. So congratulations. It's wonderful. So, okay, here comes my attempt at cool. So just to echo what Larry has said, today really does mark a significant day in the home care family of Intermountain Healthcare, and I'm so very pleased to be part of that family. This is a valuable and essential services to those that we serve, and I imagine that every one of us has been touched by home care in some way, including myself. If you think about it, probably most of you, or at least someone that you know, or one of the members of your own family has received home care. And there will be more and more of us that do receive home care in the future as we transform our industry and we're able to provide more complex and innovative care in the home care setting beyond what we're already doing. And so this facility is providing that opportunity to deepen our commitment to serve those in need in every way possible. And so I'm just delighted that this has been a vision for several years that is now a reality in this very beautiful community. And what wind? I'm ignoring this. Someone mentioned that this is purely a breeze, and so it's really wonderful. So without further ado, I'm going to turn this over to Joanne and thank each of you for being here today and for your commitment to making this a reality. It really is extraordinary and a jewel within Intermountain Healthcare. So, Joanne.
Like Laura with her cool sunglass look, I have that cool windblown look, so I think I'm right up there too. I truly am excited to be here today. It's an honor and a privilege to be part of this organization, and I think few of you will disagree that there's a critical need for a new building for home care and hospice, and I congratulate everyone who has worked so hard to make this possible. Being part of the board is just a great experience for me. We have just amazing members of our board, 16 members from the community that work so hard, and they come from a diverse group which includes medicine, nursing, the media, retail sales, the legal profession, education, advertising, and finance. So we have such a great group of people that give their time on a voluntary basis to make this a great organization. More important, though, than our board are the employees of home care and hospice. They are awesome, and as a board, we recently had an opportunity to go out and do what's called shared visits, where each board member chose areas of home care and hospice that they would like to go with an employee and make those visits and meet those clients. And I had an awesome opportunity to do a hospice visit with Dr. Mark Kopecki. And as we visited an elderly woman in the area who had terminal cancer, it just opened my eyes to so much care that is provided by hospice, and not only in assessing patient needs, but in working with families and giving them the support that they need to care for their loved ones. Others on our board chose other experiences. Some chose to visit IV therapy and see how solutions are compounded, or how oxygen tanks are filled, or how great care is taken in fitting clients for wheelchairs and providing that service. Not only am I proud of the work that these employees do, but also I'm proud of the charitable care that's given by Home Care and Hospice, and our foundation, Home Care and Hospice Board, and the efforts that are made by those people, which include Judy Blofus, Dan Nelson, Keith Perry, and others who work so hard to provide the care this community needs to those who can't afford it. As I said, this day truly belongs to the employees of Home Care and Hospice. They deserve this new facility. The new design, as you can see, is in stark contrast to the building that they're currently in. I always have to smile when I look at those winding hallways and you know, the endless cubicles and the little natural light, and even finding the women's restroom can be a challenge. So it's really a needed building, and it's clearly, as you look at these pictures, in contrast with this new airy building, and it's going to be really nice and visible to the community. It's also going to offer great energy to the staff in fulfilling their mission, vision, and values, which are mutual respect in treating others the way we want to be treated, accountability in accepting responsibility for our actions, in trust that we can count on each other, and in excellence that we do our very best and we always strive to do better. As a board member and consumer, I just again want to congratulate everyone who's made this possible, and I want to recognize Jan and his staff who are here and the tremendous work that you do. Rarely have I seen such great leadership and organization, and I applaud your efforts, and thank you again for joining us today.
Welcome. My name is Jan Goodrich. I'm the Administrator and Chief Operating Officer for Home Care. And I wanted to acknowledge that my hairstyle is uniquely designed for days, blustery days like this. This is a very proud day for all of us, a very exciting day for Home Care especially. I've been part of the Intermountain Homecare team for 20 years now, almost. And I've seen remarkable change, growth, and new opportunities going forward. And where we are today would have seemed unimaginable from where we have been in the past. This new facility is an enormously exciting new chapter for us. Home care, as I think some of you know, has existed in one form or another for many, many years, actually for hundreds of years. Physicians, nurses, and healthcare professionals have been delivering care actually in the home for a long, long time, as long as there has been health care. As early as the 1960s, Intermountain hospitals were sending nurses to the homes of their patients, not in an organized fashion, but based on common sense and a real need. Our home care division began to take shape in the early 80s, and by the mid-1990s, our service lines of home health, home medical equipment, hospice, and home infusion therapy were combined into what is now Intermountain Homecare. We're now Utah's largest and most geographically diverse home care agency with locations from Burley, Idaho to St. George, Utah. And many people are surprised by the extent of the services that we're able to provide. I just wanted to enumerate a few of those so that you know what we will provide out of this building. Whether that means skilled nurses providing chronic disease management, or a medical equipment team who provides oxygen to people's homes, or the largest and most skilled wheelchair shop in the state providing independence and mobility through customized wheelchairs, to our home infusion and pharmacy services that allow people to self-administer IV therapy without having to visit a hospital infusion clinic. At other times, it's the gift of our hospice team, which many of you are acquainted with personally, who help those with advanced illness to get the very most out of their months, days, or weeks that they have left in the comfort and dignity of their own homes, which is a wonderful blessing for people. Home care, to those who are familiar with it, is an obvious choice. If you're sick, most people would really rather be at home. That's where people heal better. That's where they want to be with loved ones. Close to their own refrigerator and all the comforts of home. We take a great deal of pride in allowing patients to do exactly that. As our nation continues to focus on how best to provide the highest level of care with the lowest appropriate cost, which is the big challenge of our day, and as our population continues to age, home care is going to have increasing value. The future of healthcare that I envision will likely occur at home as the default model, challenging the notion of traveling to special bricks and mortar locations for all of our care. We will focus more on personalized health care, a paradigm that moves care to the home, becoming more proactive and prevention-driven. As 2014 approaches, home care is preparing to celebrate our 30th anniversary. And what a wonderful anniversary gift this will be. Thank you for being here to help us begin this celebration.
Good morning. It looks like most of you are experiencing the nature of South Jordan. As you may or may not be familiar, South Jordan was originally named Gala, Utah, and I think you now understand why. I've been told several times that there are three elements to a great talk. One is to stand up, one is to speak up, and the other is to shut up, and I'm planning on doing that today. It's a pleasure for us to welcome IHC to the city of South Jordan. We have had many experiences with IHC. IHC has been a great partner, building great resources to our south in the city of Riverton, their hospital there. In addition to that, our clinics throughout the area. I've had a pleasure of being involved now a little bit with IHC Corporation personally, and that is as I have a son that is doing his residency at McKay Hospital at the present time. His wife is the daughter of Dr. Thomas Bowd, who is a physician over here in West Jordan as well. I'm pleased about what's being built in South Jordan right now. IHC has been lauded in many times in different places nationally about their innovation and their creativity. And I believe these new buildings embody part of that innovation as well. We're building facilities that are a new paradigm on how we're going to deliver medical assistance and health in our community. Not only has IHC been involved in this kind of work, but I personally last year had an opportunity to be involved in what they called the Mayor's Heart Challenge and the Healthy Heart Challenge. That was a great experience. Not only did I learn opportunity and activities that I could be participating in that would help me personally, but it allowed me to give that information to my community. IHC continues to be involved in those kinds of activities, which is reflective of the community of South Jordan. We have an active community, a community that wants to be healthy, that quite honestly doesn't have an interest in visiting the hospital. And if we can keep them healthy, if we can keep them in their homes, if we can keep the home health care active in their lives so that they can remain active and strong and healthy through the duration of their lives would be a fantastic goal for all of the healthcare community. We're grateful for you. We often quibble a little bit in South Jordan City, and we worry from time to time if a development will come to South Jordan City that would be, quote unquote, the ugly building. And this is not the case here. These are beautiful facilities that will be welcomed into our community, well maintained and well organized. Without further ado, we welcome you here. We're grateful that you're here. We welcome IHC to the city of South Jordan.
Mayor, thank you for those comments. I don't think it feels like a gale. I think it's just a nice, calm breeze that we have out here today. Although as I look right through those trees, I've been watching this windmill out there, and it's just a spinning. So maybe it's a little more than a breeze, but what a great morning, what a great event, what a great time to be here with all of you. You know, I don't live here in South Jordan. I live across the valley, but my second son has lived here in South Jordan for the past 5 years. My son, my daughter-in-law, and my grandson. And they live up 118th South. And I was afraid that Jan and his team were going to jump the gun on the groundbreaking and get going on this project before they had authorization. So I modified my route to my son's home about 6 months ago. But if I didn't know better, I'd say the official groundbreaking has already taken place. By the looks of things and by the sound of things, I think the groundbreaking is well underway. But what a great event. Thanks for being here. It's just an honor to be with you this morning. Thanks to our speakers and their great messages. Thanks to executives from Intermountain Homecare that have joined us here today and that have been so supportive of this project along the way. thanks to representatives of this great city of South Jordan, and for business leaders and those of you that are representing the business community. We also thank Oakland Construction and MHTN Architects. Thanks to all of you. This has been a great morning. Now, what we came for was the official groundbreaking, even though, as I already said, I think the official groundbreaking's already taken place. But we're still going to commemorate and have an official groundbreaking here in just a moment. After the groundbreaking, we invite you to stay. There's refreshments at the back of the tent. I don't think they've been blown away. I don't think that the sand has been blown in the refreshments. They've been kept covered up. There's also a picture back here at the back of the tent. We invite each one of you, if you haven't already done so, to sign that picture matting. We would love to have that as a memorabilia that we can keep for many years. Now we're going to proceed with the official groundbreaking. So those that have been invited to grab a shovel and a hard hat, we're going to go right outside this tent, put on a hard hat, grab a shovel, and we're going to do the official groundbreaking. So those that have been invited to participate in that, if you'd join me, and then afterwards, again, stay, mingle, socialize, have some refreshments, and again, thank you for being here.